Good morning, and thank you for joining us today to discuss credit balance function of the WPS Secure Portal. My name is Karen Curtis, and I am a provider outreach and education specialist here at WPS. Joining me today is Leanne Foster. Leanne's going to help me out by monitoring the chat for questions that you may have and providing additional information during my presentation. Now, before we get started, I do want to clarify that this function is only available to Part A providers who submit claims to the Fiscal Intermediary Standard System on a UB04 or an 837I. If you try to follow the steps that we go through today with a Part B NPI, you will receive an error message. So I just want to let everybody know that before we get started. Now, I have just a couple of things to cover before we go. The Training Center webpage is where you can find information related to the provider outreach and education team. You can find a link on this slide, and it's also going to be added into the chat. Now, once you are there, you can choose the live events card, which will bring you to a list of all the webinars that we're going to be holding for the next 6 to 8 weeks. You can register for upcoming events and download copies of the presentation that we show during our webinars. So if you haven't gotten a copy of today's slide deck, there is still time. Just click on the link in the chat and that'll get you there quickly. Now, the Training Center is also home to our Encore Presentations webpage. Videos are available for up to 90 days and they can be watched directly on our website. After that time, they will be removed from the website, but they will remain on our YouTube channel until the information changes. Now, later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. I did receive a couple of pre-submitted questions, which I will answer that time. If there's any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. At the conclusion of today's webinar, excuse me one second. Okay, sorry about that. At the conclusion of today's webinar, you will be asked to provide feedback on how I did today. This is your opportunity to let me know what I did right, as well as if there's areas where I need to improve. This is also an opportunity to provide topics that you would like to see covered in future education. Now, while this is a CMS survey, WPS does look at our results and we do our best to make the changes that you ask for. Here at WPS, we do our best to provide you with accurate, up-to-date information. If you've worked in Medicare for a while, you know that Medicare rules and regulations can change. So for this reason, the CMS website should be checked for updates, and the federal regulations are going to take priority over anything that's presented today. I also need to let you know that CMS does prohibit the recording of this webinar. We're recording the event so it can be posted to our Encore presentation. So if there's anything that you missed that you feel like you need to review or that you want to share with a coworker, you will be able to do that at a later time. Now today, I hope to increase your knowledge on how to submit credit balance reports. We're going to do this by me providing some general information about credit balances, and then we're going to go through the submission and the search process that you'll find on our secure portal. So let's start out with a little general information about credit balances. A credit balance is an improper or excess payment a provider receives due to an error in patient billing or claims processing. This can occur for many different reasons. A provider may be paid twice for the same service. This can occur with Medicare or with Medicare and another insurer. A facility may receive payment for a service that was planned but not performed, or maybe you get payment for a non-covered service. Now, although the system does take steps to avoid payment of non-covered services, this can still occur. Maybe there's an error in calculating the patient's deductible or coinsurance amount, and that resulted in receiving an overpayment. Situations can also occur where a hospital is paid for outpatient services that should have been included on an inpatient claim. Now, in December of last year, some changes were made to the credit balance reporting process. Previously, Part A providers were required to send credit balance reports quarterly, even when there was nothing to report. So while mandatory quarterly reporting has ended, providers are still required to report self-identified overpayments. WPS encourages providers to continue to adjust claims when an overpayment is discovered, but if a claim can't be adjusted because of age, or if you're trying to adjust a claim and it won't process correctly, then the use of the credit balance reporting process is going to help you with that. So there are a few ways overpayments can be handled. I mentioned that you will want to continue performing adjustments when possible. If a credit balance report is required, the preferred method is the portal, but the report can also be faxed or mailed. You will also see that there is quite a difference in the processing times depending on your choice. There is a WPS article that lists the fax number and the mailing address. This is the first link on the resource slide, and we will take a look at that a little later. So next, we're going to take a look at how to submit those credit balance reports using the secure portal. Now, the credit balance function is for Part A providers whose claims are submitted on a UB04 or 837I and processed through the Fiscal Intermediary Standard System known as FIS. The option can be found on the practice card for standard users and MPI administrators. Those who have eligibility access will not have this on their home screen. So if you are an eligibility user and part of your job is having to handle credit balances, you would want to contact your MPI administrator so that your access level could be changed. Now on the right, you're going to see the practice card of a standard user. The MPI administrators have an additional function titled Users, which would appear directly under the My Profile button. So if you select the large button that reads Credit Balance Report, this is going to open the search function. Here's where you can search all of the credit balances that have been submitted. Now the smaller button on the right that contains a plus sign is for credit balance entry, and that's what we're going to look at in more detail. So when you select the plus or the add button, it's going to open the credit balance report entry screen. The top of the form is going to contain the provider's information. The registrant name and email will auto-populate. There will be a Part A service location drop-down box where you can choose the MPI for the credit balance. If a Part B MPI is chosen, then the user is going to receive a message that says the CMS 838 credit balance form is only applicable to Part A MPIs. Please select a Part A MPI to continue. So once that MPI is selected, then the PTAN, that little bottom field that you see there, is also going to auto-populate with the provider number. Contact information is going to be the next section. The contact name and the number will auto-populate based on the user's My Profile page. If it should be someone else, then you're going to want to enter the contact information in the appropriate fields. You will need to enter the name and title of your provider's officer or administrator that is certifying the credit balance report. Now, the next section is going to be selecting the fiscal year. And when selecting the fiscal year, you're going to want to choose the quarter in which the overpayment occurred. The drop-down box is going to allow you to choose a quarter, or is only going to allow you to choose a quarter that has closed. So credit balances can be submitted for the previous 2 quarters through the portal. For anything older, then you're going to want to contact our financial department. The email address is in the first 2 resources located on the resource slide, so we'll also take a look at that a little later. Now, since the mandatory quarterly reporting no longer applies, the section I need to fill out a credit report balance detail page is going to auto-populate. I'm not sure if the portal team will eventually remove those other 2 options or not, but since they no longer apply, that it just auto-populates for you. Well, this brings us to the credit balance report details. Information can be added in 2 ways. If you are entering 30 claims or less, you can select the add line form of entry. If you have over 30 claims, we do ask that you enter the information onto a spreadsheet and upload the file. There are some requirements if a file is uploaded. File names cannot be more than 100 characters. The accepted formats are listed. You'll see them here on the slide, but they are listed within the portal. The file size cannot exceed 100 megabytes. And lastly, attachments cannot have password protection, macros, or external links. So when you select the Add Line button, then the screen is going to expand so that additional information can be added. It's going to start with beneficiary and claim information. You'll start out by entering the patient's first and last name. Next will be the Medicare ID, which will be the Medicare Beneficiary Identifier, or MBI. As we move down the form, the next field is for the claim number. If the credit balance report is the result of a duplicate payment, you're going to want to report the data of the most recently paid claim. Underneath there is a button where you can verify the claim number. Next, you're going to enter the type of bill for the original claim. For example, a 111 for inpatient hospital, admit through discharge, or a 131 for hospital outpatient. Next, we have the admission and discharge dates for the claim. If you're entering an outpatient claim, this is going to be the from and through dates. Then you will enter the date that the claim was paid. Now, additional information that is required includes if the cost reporting period is opened or closed. An open cost report is one where a notice of program reimbursement has not yet been issued. Do not consider a cost report open if it was reopened due to a specific issue. Next, you're going to enter the amount of the Medicare credit balance as determined from your patient or accounting records. The amount repaid is the amount being repaid to Medicare with the submission of this report. Then you'll need to let us know the method of payment. So you'd select a C if you're submitting a check, an A for a paper claim adjustment, Z for a combination of check and hard copy adjustment, or X if an adjustment has already been submitted either electronically or hard copy. The last field on the slide is to report the amount of the credit balance that remains outstanding. Next, you're going to give the reason for the credit balance. Was this a result of a duplicate payment, a primary payment from another insurer, or is there another reason? If you tell us that the credit balance is due to another insurer making a primary payment, we are going to want to know about that payer. So first, you're going to use the drop-down box to select the value code that matches the type of insurer who made the payment. If you've submitted Medicare secondary payer claims, these are going to be the same value codes that you use to report primary payments on your claim submission. Now, I have included a screenshot of the drop-down box in the lower right corner so you can see everything that is listed. Now, we're also going to need to know the name and address for the primary payer. Once that information is completed, you can select the Save Line button. Um, Notice there's also a Clear button in case you need to clear the form and start over again. Now, the saved line is then going to display showing the line number, the beneficiary name, and the Medicare number, as well as the claim number and the paid date. Under the action header, you're going to see three icons. There's an eye to view the line, a pencil to edit the entry, or a trash can if you want to delete the entry. Now, if you have other claims to enter, you'll select Add Row, and you'll enter data for additional claims. After all of the claim information has been entered or uploaded, you will be asked to certify that the information entered is complete and correct. The form will be signed electronically by selecting I agree. You will then select Review if you are ready to submit, or Clear to clear the form and start over. If you choose Review, then you're going to receive a confirmation page where you can review the information that you've entered. If everything is correct, click Submit. The page is then going to refresh and you're going to receive a message indicating successfully submitted along with a tracking number and details of the credit balance submission. Now, at the beginning of the presentation, I showed the practice card, and that had that big button that read credit balance report and a small button with a plus or add sign. So if you choose that larger button, you're going to open the credit balance search function. You have a variety of fields at the top of the screen that are going to allow you to narrow your results. If you're someone who has access to multiple MPIs, you can use the MPI dropdown to narrow the results to a specific provider. On the last slide, the confirmation page gave you a tracking number, so that can be entered in the tracking number field to search for that specific report. You can narrow the results by submission date. There are fields for both the from and to date. In the status field, the drop-down allows you to choose from submitted, pending, complete, or not accepted. Other fields to narrow your results include the PTAN and the fiscal year end date. Results are displayed showing the tracking number, the status, PTAN, fiscal year end, and the last activity date. Again, under the actions header, you're going to see an eye icon, and that's going to let you view the credit balance. Now, if you select the eye, it's going to open this view of the credit balance submission page. Notice this looks a lot like the confirmation page that is received once you click submit. Now, in the upper right corner, you're going to have the option to print this page, to go back to the previous screen, to start a new search, or simply select done and it's going to take you back to your home page. This page also contains some links under the generated forms and under attachments. Now, this screenshot was taken from a test environment, so the attachments are blank, but I did want to show what would happen if you clicked on that generated forms link. So this right here. Now, clicking on that link, it's going to pull up a form. It's going to show all the information that you entered, and it populates the information you entered to a CMS 838 form. This form can then be downloaded or printed if needed. Each of the claims entered using the add line option are going to be populated onto the spreadsheet that you see there on the right. Now for the resources, I've included a WPS resources regarding credit balance reports along with a link to the portal manual instructions for using the credit balance, add, and search features. I've also provided a link to the CMS 838 report. That form can be used if you have over 30 claims and you need to update a file. So it's going to look like that last slide. You just fill out that spreadsheet and you'd be able to upload it using that function. Lastly is a link to the CMS Internet Only Manual, Chapter 12, and that includes instructions if anyone is interested in how to fill it out. I do want to take you to the first resource since I mentioned this earlier. Now, I am in the J5 Mac Part A. I did verify that this address does not change from J5 to J8. So if I switch to J8, it's still the same PO box. Sometimes that jurisdiction matters, and in this case, it's not going to matter. But at the top here, there is a link to the overpayment notification refund form that can also be used to report overpayments when the claim cannot be adjusted due to age. Here is where you're going to find our fax number and address for those who are not able to use the portal for submission. Earlier, I mentioned that credit balances can be submitted for the previous 2 quarters through the portal, but for anything older, you're going to want to contact our financial department. So here is their email address right here. You can contact them. And no, it does say to not submit credit balance reports via email due to possible PHI risk. So this is going to be more if you have a question. It also has the customer service number that you could reach out to them. I did receive a couple of pre-submitted questions. I had one that asked what options are available if you are unable to submit an overpayment on the portal, and another asked about how to resolve an overpayment when it is past the timely filing. So hopefully that last resource that I showed you, that's going to let you know what your other options are to get that information to us. Now, I did have another question that I received, and the registrant asked, what is the minimum threshold of credits? We have been advised that Medicare will not recoup anything under $25. Now, I did some research. I could not find anything given a minimum threshold of credits. I did find that Section 1866 of the Social Security Act does state that providers should return any money that was incorrectly collected. So that leads me to believe that there really isn't a minimum threshold. Now, if a provider receives an overpayment of $25 or more, then the MAC is going to initiate the overpayment recovery process by sending a demand letter requiring repayment. So I'm not sure if maybe that's where the confusion came in. Medicare contractors will initiate the process if the amount is $25 or more, but any overpayment should be repaid. So hopefully that clears up any confusion. Now that was all that I had for pre-submitted questions, so I will ask Leanne if anything has come through in the chat.
Karen, we do not have any questions in the chat.
Great, thank you so much. We will go ahead and move ahead. After the close of today's webinar, you are going to receive a thank you for attending email. There are two sections that I would like to draw your attention to. The first section is titled Your Opinion Matters, and this is going to give you an opportunity to provide feedback if you've not already done so. The second section is titled Certificate of Achievement, and this gives you proof of attendance and contact hours, and that way it can be submitted to your accrediting organization for continuing education units. Now, if you don't get this email, please check your junk or spam folder. You'll also need to add Messenger at webex.com to your safe sender list in order to avoid any issues in the future. Now, if you joined only by phone, WebEx is unable to generate this email. So in those cases, we do ask that you send an email to the education mailbox and include your name and the phone number that you use to join, and then that way a certificate can be emailed to you. Now, if you think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the line so that staff knows that your question is related to this webinar, and they will send it directly to me. If you do have something that's very claim specific, those should go to customer service. Now, when you disconnect from the webinar, you will be redirected to a CMS survey. I'm also going to have Leanne add this link in the chat. I really do hope that you'll take a minute to provide feedback on how I did today. The redirect does look like what you see here at the bottom of the screen, like right here in the middle. And we don't have any control over how this appears, so we just want you to know that it's not spam, it's nothing malicious. If you click the continue button, it will take you to the survey. Now, some people ask, what do you do with our survey comments? And we have made some changes based on those comments. Chapters have been added to our encore presentations in YouTube. So this kind of lets you jump in between the webinars, like you can jump to certain spots, maybe something that you're interested in, or you could go back and review something. It just makes navigation a little easier during the videos. Training indicators were recently added to the description of our webinars to help you decide if the material applies to you. So although sometimes you can tell from the title, the training indicators will provide more detail. Like for this one, I think we had an A and a fist, just so that if somebody's reading the description and they're like, oh, do I need to know about credit balances? It gave them a little more detail, like if you're Part B, this doesn't apply to you. The last thing here on the slide is the Medicare Education Expo. We had one back this summer over LCDs because we had so many people put that they wanted LCD education for future topics on our survey, so we just did a whole day dedicated to it. We are holding another expo next week on the 16th. And that day is going to be dedicated to the life of the claim. Since we do have a minute, let me take you out there. If you click on the training center, and then we click on the live events, please scroll down to the October 16th and you click on the time. It will take you to the page where you can register for the event. So it has all of the events that we will be holding that day. You can see we're going to start out with provider enrollment. We'll talk about Medicare documentation. We're going to split out the webinars for entering claims. So we'll have a Part B and a Part A, kind of the claim process. And then we'll go into post-payment claim reviews. And then we are going to have, after a couple days, we are going to have a follow-up Q&A session. We wanted to give time for people to enter questions that they want to know after they see the presentation. So if there's any of these that you're interested in, you just click the register now and get registered for those events. We hope that you'll take time to join us for those. Now that does bring us to the end of today's presentation. On behalf of myself, Leanne, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.